We're going to make that transition from hospital to in-home care, and we're going to take the hospital out and put it in your home.
I would love to know what you believe is the way that AI can actually address what everyone knows, which is the shortage of the healthcare worker force. What elements, how, and what is it going to take, and what's the timeline for that to happen?
Well, I'm an advisor for the country of Singapore, and by the year 2030, a little bit over 25%, it's about 26% of the population will be 65 and older. Imagine that. In the United States, we're roughly around 17% right now. And so, as we know, one day you and I are going to be retired, and there's some kid out there that's going to be taking care of us. But the problem is, there's not enough healthcare professionals. It's going to get to the point where we're going to see more and more people, unfortunately, I'll give my ER example, dying in the emergency room because we just don't have the bandwidth to be able to bring them in. Something has to give. I personally think that something is two things. It'll be AI with a robot. And why do I say that? There's some tasks that are at hand that don't necessarily need a human. Let me give you a real example. Some of my older nurses are like, hey, Dr. Castro, my back is killing me. Can you help me lift this patient? I can't lift this patient. I need a couple of people to help me. And it may not be someone that's obese. It's just that as they're getting older, it's tougher. And it's getting to the point where some of these individuals are saying, Harvey, it's time for me to retire. I physically, I'm done. But I'm ready to go, but physically I can't. And so we're now seeing some nurses that are working from home and doing telemedicine to the ICU and different ways of helping because physically they can't. But what if I could bring in a robot next to me here, and then the robot is the vision of ChatGPT, can say, hey, this person's hemoglobin A1C is low. I can see it. Or their voice. These are all things that are true. Their voice is, I'm picking up prediabetes just with their voice. And when I look at the patient, I'm seeing their blood pressure just went up. All of these factors now will have it in facement with the robot. Now it's powered with AI, doing it together. And I really think that is the salvation. I know I'm sounding dramatic, but I really think this is what's going to help humanity. It's going to help us do that. Now, I know the second thing people say is like, hey, Harvey, I don't like this future. I think I'm going to be out of a job. I need to do a piece on this. I keep saying I'm going to do it and I keep forgetting. I call it the great shift. If I'm a family practice doctor in West Texas and I'm sending everything that has derm to the big city of Dallas because I don't know, then I'm doing an injustice to the dermatologist. But if I'm in West Texas and I'm using my AI and I'm taking pictures of the rash, and then it's saying, oh, this is squamous cell carcinoma, this is how you treat it. Then I go through books, I'm like, oh yeah, that is. And now I don't send it to the Dallas. Now I'm actually calling it the great shift. Now, the dermatologist is not losing a job. That dermatologist, he or she is going to see very specific sick patients in their specialty. And if anything, I feel like the family practitioner is going to be able to see more with leveraging AI. And so I think if anything, these kind of tools is what's going to help. Biasly, I'll say the last thing. I'm part of a company called Help AI. We're putting monitors in people's homes. And then you're like, oh my gosh, that's a little freaky. But this is what we're going to be doing. It's going to help with compliance. So if I'm at work and grandma or my mom forgot to take their medicine, the AI would be like, hey, you didn't take your medicine. Or, hey, she took it twice. And I would get a text and be like, hey, your mom took her medicine twice today. You need to call her and be like, hey, no more meds for today. All of those things, we need other tools. And the last thing I'll say is we're going to make that transition from hospital to in-home care. And we're going to take the hospital out and put it in your home.
That's extraordinary. And it kind of, gives you this idea of continuous longitudinal appreciation and understanding of a human rather than just the briefest picture or snapshot from how often they come into the ER or how often they see their primary once or twice a year, right? Unless they have a problem. You're just seeing a snapshot. And I would say that about labs too. It's a brief transient moment in what is 24 hours of the day. And I think that's part of the problem is you can only treat so well when you have snapshots and only so accurately when you don't have context. And context and longitudinal understanding of somebody happens continuously. And there is not a single faculty of the healthcare system that really kind of fosters that concept today. And I think AI, to your point, can really help that. The thing that I found interesting on that, on the recent study where they tried to, and again, it's nothing, end all be all, but AI wasn't as good, if I recall correctly, at obtaining the history and the relevant pieces and points that was necessary. So physicians did well on that. And that's where I see this beautiful synergy, whether it's a physician, whether it's a nurse, it's triage, what have you, is the human knows kind of in their entirety of experience of what to go with, when, and where. Then it's the challenging bandwidth problem is really assessing immediately all the possibilities and diagnoses and different, considerations of the lab work with the picture, et cetera. That's how I see the synergy. How do you see it with outside of the clones and the monitoring of something that may be more immediate in the next 2 or 3 years of how it can be a synergistic relationship?
Yeah. I love ambient scribing. I think it should be standard of care where, there's no reason I should be looking away or typing. I feel bad for some of my older physicians. They literally would come on their days off to finish their charting. And I thought that shouldn't be the case. Or having another human in the room typing stuff and you don't know what they're typing and if that's really in par of what you were wanting to be. So I think the ambient scribe is here and there's no reason we shouldn't do it. It's getting cheaper and cheaper. The second thing I want to say is this is the worst this will ever be. So if you don't like it today, give it another test drive. Maybe not tomorrow, but maybe a week or two. You never know. I mean, it gets that much better. That's quickly. I think as we move forward, what you said, and I want to add this, the emotional intelligence of AI will only get better. You see, there's some AI out there that exists that can analyze all my micro expressions. Was I upset? Was I angry? And I've been thinking, sometimes we get so tunnel vision in our diagnosis that sometimes there's little blips that we're not really looking at the patient. We're processing. But if the AI, with the patient's consent, could look at the patient and say, your patient said they smoke 1 pack of cigarettes a day, but it's more like 4. Like you could see it on their eyes. You and I, there's some stuff that we know we ask and we're looking for those small details because we know we're getting lied to. And that's okay. We're their physician. That trust is not there yet. But if the AI could help me catch, or if I'm giving a diagnosis and as you know, telling people they have cancer at one moment, they turn off. You can go for another hour and they didn't hear anything you said. But if the AI can be like, whoa, pause, patient's not listening anymore, repeat. Or let's just take this AI to the next level. Say I'm diagnosing that person with cancer. It's the Charlie Brown moment. And then at that second on, we're recording everything. And then now when that patient goes home, I say, here's this file. It's everything we talked about. And then now that patient's spouse comes home and it's like, hey, honey, what happened? And you're like, I don't know. I just told me I had a cancer and I don't know anything else. But then you can put on that transcript that went over everything. It could be 2 a.m. See, those are the things we need to do to deliver best healthcare.
Yeah, and I think I was very fortunate that, when you start your career, you have a little more time with patients because you're building your practice, et cetera. And early on, I got to appreciate how, especially with something as scary as cancer in a stage 4 setting where people are living years and there's decisions to be made, where sometimes a family member may say something to answer the question because they're usually the most vocal, and you just have to catch. And if you even are able to see them, the patient's face. So I always made sure I could see the patient and the primary speaker, if it wasn't the patient, in the same visual field, that it may not have been reflective of what they wanted, but they don't want to disappoint their son, right? But they're tired or they wanted to make the wedding. Like that kind of play led to, me having to cross the discomfort of being like, is that exactly what you want? And it led to this solution that even the loved one that wants the best for their loved one is like, oh, really? Like, you didn't tell me that. Like, but that makes such a big difference on, the how people die at the end of the day, because we're all dying. People forget that. So I just think it's such an important point you made.